talk about in terms of, or we're talking about in terms of homeopathic medicine is that alternative piece. And how does someone find a good or reputable homeopathic doctor? What is it that they do to seek you out?
Okay. I just want to mention that homeopathy is also, again, it's underneath the naturopathic umbrella.
Okay. All right.
So there are homeopaths who do naturopathic doctors or physicians who do specialize in homeopathy.
Okay.
But there is a website. It's the Naturopathic Association, and you can look under that, and you can go into your region, and then you can find a naturopathic physician in that region, and it'll locate you.
Okay. What qualifications should you insist on when trying to seek out a homeopathic doctor?
Well, there are three things that you need to seek out. If they have gone to a 4-year accredited medical school in naturopathic medicine. Second thing is if they're licensed.
Okay.
And then the third thing is also you want to see some naturopathic physicians do take a 2-year residency and then also a research fellowship. But if they don't have that, that's fine also. That's what you want to know.
I understand that oftentimes in a treatment plan, how long does it take to come up with a single individual remedy that helps to best fit a patient's need?
Okay, I'm sorry, repeat that again?
Okay. How long does it take? I know everybody's situation is different, but typically how long would it take for you to come up with one person, a remedy to fit a patient's need?
Well, usually initial intake for a client or a patient that comes in is about 2 hours.
Okay.
We take a while. We do a 45-minute physical examination, an intake history, and then usually we end it with this is a treatment plan.
Okay.
And then after that, we usually do give them something dealing with the symptoms. I mean, it's really important that the person or the patient, the client is not, in pain. And again, it's decreasing the fears. First do no harm is one of our rules. So, we leave them off with a supplement or botanical or just a diet plan. And then we do have them return. And usually return visits are usually 15 to 20 minutes.
Okay. And is there, what are some typical questions that someone might ask in a homeopathic when asking questions?
Okay, well, like I said, with the intake, usually it's, have you seen a conventional doctor? What are your diagnoses? What are your prescribed medications? That's very important because a lot of botanicals do have some interactions with the prescribed medications. And then after that, tell me about some home remedies that you have done yourself. You want to see what they're doing, if they're aware of it. Because this is pretty new in society. People are not totally aware of naturopathic medicine, so you want to see what they're at. And then lastly, what you do is the whole. You go into the emotional, psychological, and the physical.
Okay.
And then you just end it like that.
Okay. Well, you've given us a lot of information with regard to the homeopathic piece. And I think that, I think one of the things that we can also possibly talk about maybe at another time might be the higher level of malpractice. I'd like for our viewers to stay tuned to hear more about the kinds of knowledge you need to arm yourself with when considering a natural or holistic approach to treating various medical problems.
Recent research shows that it does increase serotonin levels. It also increases a healthy start for blood sugar levels and also breathing and respiratory, all of which physiologically affects a lot of the symptoms that people do or patients do have. So it's very important. We try to entail it and refer them to a trainer or even themselves stretching, breathing, meditation.
Heart disease and hypertension is growing quickly in the African American community. And what exercises or movements have you found to work best to manage these diseases along with a conventional or naturopathic treatment plan? You do.
Yes, warm-up is absolutely important because you're taking your body from a resting rate to performance. You're increasing your temperature, which you need to do for both your body, and you're increasing blood flow in your body to your muscles that you're going to start working. So it is very important to give yourself a warm-up so that you then are ready to perform, and that also prevents injuries.
Excellent. Now, another part of the
cardio is extremely important because your heart is a muscle. And what you're doing when you're doing a cardiovascular movement, a cardio workout, is you are strengthening your heart muscle so that it can pump blood more efficiently in your body. So what we do, you make sure that your new client understands the way to focus on their own target heart rate, which is 220 minus their age for a beginner times 0.65. So you get to that level and you stay there for a prescribed period of time in the cardio segment.
How long is that? How long is that? You did the calculation, but how long is that?
Well, an exercise prescription is based on a number of factors besides just the age of the client. So it depends on whether the person has not started working out before, but typically a 30-minute workout for a beginner through all the stages is about as much as we would do.
Okay. Now another part of the movement process is toning. Can you tell us a little bit about some of the toning exercises that you recommend and that you use?
Well, toning is really important because you change your focus from the muscles to your bones, and you really do need to strengthen your bones to support your weight. It is very important to add, and frequently, particularly women, do not focus on a weight-bearing part of the workout, but it is important, and so you work all parts of the body. And what's significant when you have when you're lowering your risk of a heart disease is as you're lifting the weight above your chest, you are raising your heart rate.
Okay. Now, one thing that I have to ask this question in terms of the toning piece and weights. Do you use weights every day, or do you do a day on, a day off? How often should you use weights? Well, the toning process.
A guideline is it depends on, and I have to keep saying it depends on what your goal is. If your goal is simply toning, then you could tone every day because you would keep the weights at a certain number of repetitions and at a minimal level because you're getting the toning through the repetition as opposed to the overload on your muscles. If you are trying to bulk up, then that's when you have the increased weights and you have fewer repetitions but more increased weights, and then you need to take rest in between your lifting.
Okay, so if you have 5 pounds, that would be safe for you to use that every day.
Yes, if you are someone who is accustomed to using weights and you're using it for toning, yes.
Okay.
I would not recommend 5 pounds for a beginner, but yes.
Okay. And another aspect of the exercise movements is stretching.
Yes. Stretching is very important because you have exercised your muscles, and your muscles are elastic tissue that shrink like an accordion when you're working out. So when you're finished, just like you warmed your body up, raised your body temperature, and